This video will cover the pelvic girdle. The pelvic girdle is responsible for holding the lower extremities to the axial skeleton, and it consists of two coxal or hip bones. So each of the coxal bones are going to be consisting of three bones that have fused together. Those three bones include the ilium, which actually make up these wing-like structures. The couple of structures you need to know for the ilium are the iliac crest, so that would be here along the edges. Then we also have, produced by the ilium, is the greater sciatic notch. So the greater sciatic notch is right here on the ilium, and the sciatic nerve will run through the greater sciatic notch. The ilium will also be the bone that's responsible for articulating to the vertebral column, and it does so at the sacrum. So medially, the ilium will articulate with the sacral region of the vertebral column. That joint is called the sacroiliac joint. So then we have our other bones include our pubic bones. So the pubic bones are the ones that are coming anteriorly here. So here's your pubic bone, here's another pubic bone. And those two are going to be fusing together medially at the pubic symphysis. So this cartilage here between the two pubic bones, that's going to be fibrocartilage. Then we see towards the posterior ends, so if we look behind here, we have what's known as our sitting bones. So these are called your ischium. And the way, a couple of things you need to know about the ischium are the ischial tuberosity, so that's this bumpy ridge here, and then the ischial spine. So we have the tuberosity here, and the spine is the thinner one that sticks out there. So the ischial tuberosity and the ischial spine. Those are going to be important sites for muscle attachment. So then, if we look here, we have these holes here are known as your obturator foramen. And the obturator foramen serves as a passageway for blood and nerve vessels to come from the pelvic region down into the legs. Now, you can often use the pelvic girdle to determine which sex the person is. So here we are actually looking at a female. And the females, they have more of a broad and wider angled iliac crest. And then when you look at this structure, it kind of creates a circle here. That's called the pelvic brim. So it's the border of both of these coxal and the sacrum. In females, it's much larger, and it's oval or it's round in appearance. You can also tell by looking at the greater sciatic notch. So right here you can see that it's very large and round. You can also tell by looking at the pubic arch. So in this case, in the female case, we see the pubic arch is greater than 90 degrees. So it makes an angle that's larger than 90 degrees, so you know that this is a female. Now if we look in comparison to the female, we look at the male. Also, before I move on, you can also tell by the coccyx. So females, we have a coccyx that will run straight down inferiorly, whereas males, theirs will actually curve anteriorly. So you can see how the coccyx is actually making a curve there. So that's a sure way to tell that you're looking at a male. But also when you look at their pelvic girdles, you can see that it creates a somewhat heart-shaped pelvic brim. You can see that the pubic arch here is going to be less than 90 degrees, and that the iliacs are at a closer angle to one another. So anytime on the practical, I will always make sure you have both in front of you to be able to compare. The only structure we have to talk about now is our acetabulum. So that is this structure, and it's going to be made up by the fusion of all three bones of each coxal, and it's going to be out on the lateral sides of the coxal bones. So the acetabulum is the cavity in which the head of the femur will sit.